Next is Emily Pitts. She's going to talk about the different types of caregiver programs that are available at the VA.
Good morning, everybody. I'm going to hold the mic, but if it starts coming down here, just wave at me and let me know. That way you guys can hear me okay. I will just announce that I think there's a break after me, so just keep that in mind. But if you need to take a break, feel free to do what you need to do. Thank you, Molly, for the introduction. Great job. You stole my question, though. I was going to ask who's a caregiver or who's potentially going to be a caregiver, so that's okay. I do want to ask, I saw some of you guys coming in this morning. I'm curious, who's in the Caregiver Support Program? Because I did see some familiar faces. Wonderful. We're glad you're here. We have some caregivers in our Caregiver Support Program that'll be joining us later this morning on our panel. Thank you to you guys for making that trip. We have one of our caregivers who came from Hickory this morning, so it was a toll to get here and to get the veteran prepared for such a long trip, so thank you. I also want to introduce my counterpart, Carolyn Ferris. She is in the back. She was manning our resource table. If you didn't get a chance this morning as you were coming in to get some information or talk to myself or Carolyn at our resource table, please do. We've got a lot of information, as well as our community partners that Dr. McGoy mentioned on her slide. Please stop by. We could not do this without our community partners. We can do a lot at the VA, but we can't do everything. So that is why it's really important that we connect. We have relationships with our community partners, and you guys know what resources are available to fill in gaps of what we can't provide at the VA, or if it's a situation where you're caring for a loved one who's not a veteran. So that would change services that you might be eligible for. So we really have to pull on our community partners. And I see you guys out there and just want to say thank you for coming too. It's not on one of my slides, but I think it's important to talk about where we've come in the caregiver support program over the years, and how we've grown and why. And a lot of that has to do with the VVA and a lot of advocacy that veterans have done to expand the caregiver support program. The program started in 2010. It was implemented at all VA medical centers in 2011. When we first started the program, it was for post 9/11 veterans. So when Congress made public law the Caregiver Support Program, and that all VA medical centers would have a Caregiver Support Program, its intention at the time was for post 9/11. Does anybody remember that time for the program? Yeah. So with that said, fast forward to 2020. The program expanded. It expanded over a set of a few years for all veterans of all ages. It no longer mattered what wartime they served, which was huge. And again, a lot of that had to do with advocacy from VVA and from other people on Capitol Hill. So when I first started in 2018, I think, in caregiver support, we had 100 caregivers in our program, give or take. Today, we have almost 800 caregivers in our program. So that tells you how much we have grown from a staff of 2 to a staff of, I believe, 14. So hopefully some more staff in the future. Just a history of where we've come over the years. The first thing I want to do is I want to kind of just share a story. It's a story that it's a common story. It's a story that we hear pretty frequently as caregiver support coordinators in our program, and that you guys are probably pretty familiar with. But I want to tell you a story about someone I'm going to call Samantha and her son David. David proudly and bravely served in the U.S. Army in support of Operation Iraqi Freedom. David was medically discharged from the Army due to PTSD and paranoid schizophrenia. When he got home 11 years ago, he really struggled, and his behaviors were hard for his family to truly understand. He had changed so much since he had entered the military, and his mother, Samantha, found herself feeling very confused, very stressed, and very lonely, and even sometimes guilty. She shared with us that she felt like a failure, and in her own words, a bad mother. She blamed herself for not having done enough for her son to help prevent where he was today. This was the point Samantha found the Caregiver Support Program. She credits the program with helping her work through those feelings. Through the program, she learned to care for herself. She learned skills to help care for and protect her son. Through it all, she has learned a lot about herself. She has learned to love her role as a caregiver. She even gives back to other caregivers, mentoring those in similar situations. So Samantha is just one of many, many stories that we hear throughout the program. And while the diagnosis, care, needs, or relationships, they're often different, there's a lot of commonalities. And one of the great things I think about our program that I'll mention probably more than once is the support that I see caregivers give other caregivers. We get to witness that in our caregiver support groups, in our virtual trainings and workshops. And to me, that is the most important thing I think that we can lay a foundation for, is providing those outlets for caregivers to connect with others. They can listen to me talk as a social worker all day long, but it's different when it's coming from other caregivers. And I think that's one of the most amazing things that we can provide, is that connection with other caregivers. So I also want to talk about just the impacts of caregiving. We'll start with the positive impacts of caregiving that we hear also very frequently. You know, caregivers will talk about giving them a sense of fulfillment. They'll talk about it's extended their social network. They've made new friendships. Another great thing talking about support groups that we see is they connect outside of support groups. They make friends. They meet for lunch. They meet for dinner. They talk on the phone. It can feel very isolating to be a caregiver. So for those situations, if caregivers can meet and connect with other people, it can really be life-changing. We also feel or hear that caregivers start to feel needed. They feel useful. They start doing things that they never thought they could do, right? Things that they never thought they would have to do. And they learn a lot about themselves. They learn a lot about lessons in life, and also the meaning of life. With that said, you can't talk about the positives of caregiving without talking about some of the challenges. So this is some data. Molly talked a little bit about some from AARP, but I'm going to talk a little bit about some additional data just on caregiving. And this is from the RAND report. You may have heard of the RAND report. It's one of the biggest statistical studies that have been done on military and veteran family caregivers. So just to kind of give you an idea, from a macro level, where we are in caregiving as a society. But you can see up there, 81% of military veteran caregivers spend 1 to 30 hours a week providing care. Unpaid, usually, right? And that's usually on top of having a full-time job, or a part-time job, or raising children. And then you have to factor in, a lot of our caregivers are raising grandchildren, right? We have a lot of grandparents raising grandchildren. So factor that in on top of the many hours a week that caregivers are spending in that role. Of military veteran caregivers, those 60 and under, 42% met criteria for depression. That's almost 4 times the rate of non-caregivers. Depression is real, it's alive, and it's real and alive in our caregiver population. And that's a lot of topics that we cover related to depression, anxiety, caregiver burnout, as Molly mentioned, stress, to cover that depression that caregivers are feeling. We talk a lot about that in our groups, in our workshops, and in our trainings. 23% of Americans caring for another person report that their health has worsened. One of the things that Carolyn and I and my counterparts do when we're connecting with caregivers for the first time is we want to talk about their own health. And they're usually pleasantly surprised because they're so used to talking about the veteran's health. And so what we want to focus on is the caregiver. We want to know how your health is. When's the last time you saw your doctor? Are you going to your medical appointments? Burnout is real. Burnout with medical appointments is real. We hear from caregivers a lot that, I'm just so tired of going to medical appointments, I don't want to go to my own. So we want to talk to them about that. We want to encourage them to take care of themselves. And we're asking them questions that they're not used to being asked, because our program is specifically for the caregiver. And then 21% of caregivers in the U.S. report feeling alone. This is huge. I was sitting over there thinking a minute ago about, I think you may have mentioned isolation, or something was mentioned. And I immediately thought of COVID and trying to support caregivers who already typically feel alone, feel lonely. It was even more so exacerbated during COVID. So we provided a lot of virtual workshops, virtual trainings, phone calls to our caregiver population because they did feel very isolated. I remember when we were facilitating a support group, one of my caregivers got on the call, it was virtual, and she said something like, you guys are the first person I've talked to in a month other than my husband. And that was not abnormal. Our caregivers felt very isolated and very alone, especially during COVID and then also during Helene. One of the things our program did is we reached out to our caregivers after we came up with a very quick plan. We started reaching out to all of our caregivers to check in, and we did that throughout the coming weeks after Helene. And people felt even obviously more isolated than they typically did. This is the mission. You can read it. The point in this is to show that caregivers are now part of the VA mission. It says the VA's mission is to fulfill President Lincoln's promise to care for those who have served in our nation's military and for families, caregivers, and survivors. So our mission in caregiver support is to promote the health and well-being of family caregivers who care for our nation's veterans. And we do that through some of the things I'm going to go over. Education, resources, support, and services. So you guys are part of the mission at the VA, and you're certainly a part of our mission in the Caregiver Support Program. So how do we do that? We have a lot of resources. So many resources sometimes that it can be overwhelming to go over all of this with you over the phone for that first conversation. And I recognize that, and we realize that. So we try to connect with caregivers periodically and introduce services based on what we think is most important to them at that time. If I went over all of these services the first time I called, you would feel very overwhelmed. I would be tired of talking. It's a lot, it really is. So we try to introduce and talk to caregivers and do that initial conversation to learn about what a typical day looks like for you. What kind of support do you have? Do you have family? Do you have friends? Do you have neighbors? Did you just recently move here and don't really know anybody? That's going to help myself and Carolyn and our counterparts figure out exactly what services are most beneficial for you. And they're broken down into different types. We have skills training, which I'll talk about. We have online and mobile support. And then we do one-to-one coaching and individual support. We obviously do groups, and we do some coaching. We have peer mentors, which I'll talk about. And then we also do resource fairs and assist with just referrals. So we're going to break those down. So skills training. What I mean by skills training is we want to provide you hands-on training, things that will help you help the veteran. The two that we're going to focus on is our SAVE training and our CPR training. Our SAVE training is a suicide prevention training. Some of you may have heard it. Suicide prevention was here earlier. They do SAVE in the community. It's a suicide prevention training for community providers, people who want to learn how to help with suicide prevention. What we do in our program is our suicide prevention training is specifically for caregivers. So the Caregiver Support Program recognizes that caregivers could be that first line for support, right? That caregiver knows that veteran better than anybody. So we want to make sure that our caregivers feel supported and knowing what to do if they see signs of suicide. What questions to ask. When you ask questions, what do you do with that information? Like, what am I supposed to do with this information? We want them to know who to turn to, what questions to ask, and feel competent and confident in de-escalating a situation where there's potential suicidal thoughts. That's going to certainly be picked up on by that caregiver first and foremost. So the other one, this is a new initiative that we just started this year, is CPR for caregivers. The Caregiver Support Program started this initiative this fiscal year. We actually got it up and running this summer, and officially I think have 16 caregivers that have gotten certified in hands-on CPR. This is an initiative that we're going to start throughout the next year and probably continue. This is something that you guys have been asking for. We got calls quite a bit about wanting to be certified and trained in CPR. So what we're doing is we're doing hands-only CPR trainings. We've done 2 so far, went really well. We did one in Hickory at the Hickory Clinic, and then Carolyn did one at the Asheville VA Medical Center. So it is basically hands-on CPR. What the VA and the Caregiver Support Program wants is they want someone in the home to feel confident in any kind of life-saving skills until medical personnel can arrive. So what we're doing is we have the materials. It looks very similar to the setup on this picture over here on the right. And caregivers learn how to do the hands-on component of CPR. They also teach you the breathing component, but you're only being certified in the hands-on component. So if that's something that you're interested in, let me and Carolyn know. Our plan for the fiscal year is to do this at the medical center again, and also go to the C-Box and come to you guys out there in more rural areas. So not all of our caregivers can come in person to some of the programs that we offer. We have caregivers in Charlotte. We have caregivers in Gainesville, Georgia. We have caregivers towards Kernersville, Statesville. We have caregivers everywhere. So to ask a lot of our caregivers to come to us is almost impossible, whether it's logistics, transportation, whether it's they can't leave their veteran home alone. The veteran may need 24-hour supervision, 24-hour care, and it's just not possible. And I won't mention parking. That might be an issue too. So what we provide is online and mobile support as options as well for caregivers that are maybe not as comfortable doing individual or group. It's still a level of support through online and mobile apps that the VA offers. And these are just the 3 that I'm going to cover today. One is Building Better Caregivers. So this is a 6-week support group that is online. Caregivers can apply to be a part of the program, and they can do it at their own pace. And so when I'm talking to caregivers, Building Better Caregivers is a really good tool for especially caregivers that might be new to their role. They might be new to the VA. Building Better Caregivers is a really good tool. It's a 6-week course, and caregivers that complete the course get to graduate, and they become a member of an alumni association that gives them access to a chat group and to continue to connect with caregivers that they've met during their cohort as part of the program. Some of you might be familiar with Annie texting. There are protocols for caregivers. People who enroll in Annie receive 3 texts a week. I think one is motivational, one is inspirational, and then one is asking you to a task to complete. I've never enrolled anyone in Annie who did not love Annie. I've had caregivers say, I get a text from Annie exactly when I need it, when I needed to hear something inspirational, when I needed that level of support. But caregivers can sign up for different, what we call protocols. There's protocols for dementia, so that caregiver is going to get a text weekly with some piece of education related to dementia. We have protocols for Parkinson's disease, PTSD, general just caregiver support, resilience. There's tons of them. So we try to talk to the caregiver and figure out exactly what type of anti-texting would be best for them. And then you can opt out at any time. So I think you can sign up for at least 3 different protocols. More than that, your phone probably would go off constantly. But you can opt out at any time. But it's a really good program. And then we have our CSP website library. You can go to our website, which is caregiver.va.gov. Tons of information. It's a very well organized website. And you can look up information based on your specific needs. There's tons of information there about dementia, Parkinson's, MS, ALS, a lot of information, just educational resources. And so for some of our caregivers, more individual support might be most useful for that caregiver. And so we do offer individual support. It can be over VVC, virtual, in person, sometimes in the home. And one of those is our Caregivers Health and Wellbeing Coaching. Carolyn is actually one of our certified, what we call CHIWAT coaches. And it's one-to-one clinical support. It is 4 sessions or 6 sessions? 4, thank you. It's 4 sessions, and the great thing about the whole health program is it's really focusing on the caregiver and what their needs are, what's most important to them, as opposed to focusing on what's wrong with you, what do you want to fix. So that's the wonderful thing about coaching and that one-to-one support. Dr. McGoy mentioned REACH. We offer REACH in the caregiver support program as an individualized support. It's usually 4 sessions, and it's going to be focused on specific diseases or situations for that caregiver. So you do receive a manual in the mail. It can be related to dementia, Parkinson's, ALS, MS. There's several different protocols for REACH. And myself or Carolyn or our other counterparts will contact you, and we provide over the phone or virtual support, focusing on what you want to learn about the disease progression and being a caregiver related to specific diseases. And then we offer group support. So we do a lot of groups in our program. We do REACH. It can be individualized or group. We also have Caregivers First. We offer this throughout the year. It's 4 sessions. It's a really good program if you're wanting to learn how to navigate the VA. And that's one of the things that I talk to caregivers a lot about is, as far as the support we provide, yes, we do all these programs, we do workshops, we do trainings, but we help you navigate the VA. That's pretty important. And I say frequently, it's hard for the veteran sometimes to navigate the VA. It can be even more challenging for a caregiver trying to navigate the VA. So that's part of what we do in our program is be the person that you need to call when you need help navigating the VA. We also do self-care and wellness courses. We've done courses on grief, anticipatory grief, skills courses. Matt has done one on similar to what he's going to present today on safety and mobility, equipment through prosthetics. We have done, caregiver burnout, all kinds of self-care and wellness courses. And then we'll do support groups related to what we see is just a trend of what our caregivers are asking for. We recently did a support group for Parkinson's. We've done dementia support groups. So we have something going on all the time throughout the year. So we also provide peer support mentoring. One of the things that we do is we will have caregivers that want to give back to other caregivers. And so for some of our caregivers, they may be interested in being a mentor. They may want to share their knowledge, their resources, guidance with other caregivers. And so in the peer mentor program, caregivers can become a trained mentor, which means they go through specialized training through the caregiver support program, but they're also vetted as volunteers through the VA. So they go through CDCE and become an actual volunteer through the VA. And then once all that's done and that's completed, then we will connect our mentor with caregivers who are asking to connect with a caregiver. And so it's really up to the peer mentor and the mentee, the caregiver, to determine how often they want to communicate. It'll usually over the phone. And so they can provide support, networking opportunities, and just empowering that caregiver to help one another. So this is a big push for the next year for us to find caregivers that would be good mentors, as well as making sure caregivers are connected with those mentors to get more individualized support from somebody who can truly empathize with their situation. We actually just did our resource fair. This is something that we do annually. We typically do it in November, but due to Helene, we moved it to August. So we just completed our annual resource fair. It's a great opportunity to learn about VA resources, the caregiver support program. A lot of our vendors out here that were here this morning attend our resource fair. It's usually a huge success. A lot of people come out for it. It's annually, and then it's a way to just engage and empower one another and learn about what the opportunities are out in the community for caregivers. So respite. Yes, this is a big push at the VA in our program, is making sure our caregivers understand respite, know what respite is, and then how to get connected with respite. So we talk to our caregivers about the different types of respite, which could be either formal or informal. We have different types of formal respite. which can be adult day health care. It can be homemaker home health aid services. It can be being admitted into a facility. A lot of times our caregivers want to go on a vacation, or they have surgery planned coming up, and they need a safe place for the veteran to go because they're not going to be able to provide the support to the veteran that they typically do. So we talk to them about different types of formal respite, but then we also talk to caregivers about informal respite. As Dr. McGoy mentioned earlier, respite can look a lot of different ways. Teaching our caregivers just to take time for themselves. That is a form of respite, whether it's having a cup of coffee on your back porch, taking a walk, finding times during the day to take care of yourself is also a form of respite. We also have our caregiver support line. We have that flyer up on our table if you want to grab it or if you want to jot that number down. But it's a national hotline. The people that are answering the calls are social workers or licensed clinical social workers like myself. And it's a really great place to start if you don't know where to start as a caregiver, or as a veteran, or as a neighbor, or as a community agency. We get calls from a lot of different people, not just caregivers, that are looking for information about the caregiver support program. This is a really great place to start. So if you learn anything, write the number down. It's a really great resource. They'll provide counseling or emotional support over the phone. And then if you call the caregiver support hotline and you need follow-up, then we'll receive a referral locally, and then we'll follow up with the veteran and caregiver to answer any questions, get them enrolled in the program, and then follow up with any support that they need following the call to the hotline. I'll stop real quick and ask if there's any questions so far. Yeah. Sorry, Mike.
Does the VA offer this format in other locations, or is this just a local presentation? And what I'm thinking of specifically when you were talking about caregiver support line, or excuse me, the Caregivers First, where you explain how to navigate the VA.
Mm-hmm.
I mean, I have a brother and his wife in Iowa City, and they have no clue on how to navigate the VA. So is this format done throughout the country?
So I can tell you that there's a caregiver support program at every VA medical center. So if a caregiver needs assistance navigating the VA, I would definitely have them contact their caregiver support program wherever they live.
But when you brought all these people here today for this,
Mm-hmm.
and do they do that elsewhere, or is that just something that you
Yeah, it would be considered outreach. And so one of the things that Carolyn and I do throughout the year is as community outreach. We do presentations about the caregiver support program to get the word out as far as what we offer, the process for the comprehensive part of the program, which I'll talk about here in just a minute. But yes, this is part of our responsibilities, is to provide outreach and make sure you guys know what's available at the VA, especially as caregivers in the program. I hope that answers your question.
Yeah, thank you.
Okay. And another offering that we have are monthly educational calls. This is important because it's simple. It's very simple. It's purposely simple for caregivers to get involved in these monthly calls. You don't have to register. You don't have to RSVP. You just have to have this contact information. You have to have the phone number and the conference code. Every month is a different topic. And these are national calls. These come from our national program office. And the great thing about this, again, is you don't have to contact anybody to register or RSVP. You can just hop on. They're offered at different times throughout the day. So they try to do a later morning, a lunch, and an evening call just to capture people based on their abilities. And the topics are different. So each month the topic is different. So our role is to get the topic out to our caregivers, and then they can choose if they want to attend. I think it's important, and I'd say this often, that none of what I'm going over is mandatory if you're in the program. You truly get to pick and choose what is important to you, what's of interest to you, what you have time to do. So there's no minimal amount that you have to participate in to remain in the program. I have caregivers that I see at every event, and then I have caregivers that I rarely hear from, and that's okay. We'll check in, remind them that we're here, tell them about upcoming programs and events that we have, but we're here when they do need us, and that is very comforting for our caregivers. But our educational cause, to kind of give you an example of topics, they've done money management, they've done anticipatory grief, they've done coping with the holidays. Again, every month is a different topic, and I tell caregivers, hey, if it's a topic you're interested in, hop on. If not, that's okay. Okay, so if you think about the Caregiver Support Program, there's 2 separate programs within the Caregiver Support Program. The first one that I'm going to talk about is the program of general caregiver support services. And then after that, I'll talk about the program of comprehensive assistance for family caregivers, which is a mouthful. You've probably heard it referred to as PCAFC. So we're going to talk about both. We'll start with the general program, which is the program I coordinate. So for the general program, referred to as PGCSS, to qualify, the qualifications to be a part of our program is pretty minimal. Whoever the veteran designates as their caregiver can really enroll in the program. There is no application, no formal application. If you're interested in the program, we contact you, you contact us. We'll talk about all the services, maybe not all, but some of the services to give you kind of an idea of how we're supporting caregivers. And then you can choose to sign up or choose to say that's great information for the future. But it's very simple. It's purposely made to be simple. We certainly don't want to be an additional stressor. So very simple, no application. You do have to be an enrolled veteran at the VA to be eligible. And then you do have to have some level of assistance with daily living or require supervision or safety. For our program, that's very minimal. Our motto is if you're a caregiver and you want education, you want support, you want to connect with other caregivers, we're going to enroll you in the program. So services that we offer, there are the services I just went over, the skills training like suicide prevention, CPR, the clinical services that I've already mentioned, TWAC and REACH. So this is just kind of an overview. Respite will help you navigate respite. Will help you get connected with community resources that may have grant funding for respite, which is huge in a lot of our surrounding counties. There's money out there for respite, and we want to make sure you know about it. Like I said, the enrollment process is simple. We contact you. We will ask you some questions. We want to know about your role as a caregiver, what a typical day looks like for you, the support that you have. And in that conversation, it really helps us decide, okay, what's going to be the best resource for you to connect you with. The next program that I'm going to talk about is the program of comprehensive assistance for family caregivers. And I know several of you out here are in this program. So the eligibility criteria for this program, please, if you're interested in this program, this exact form is out on our table. Grab one. It goes over the eligibility requirements. This is the biggest question that I get asked is what's the criteria for PCAFC? So you can see over on the left-hand side, there's 7 pieces of criteria that have to be met. When our office gets an application, the first thing that we look at is if the veteran's at least 70% service connected. That is what we call administrative eligibility. So first and foremost, the veteran does have to be 70% service connected to be eligible for this specific program. That doesn't mean claims pending. It means at the time you apply, you have to have that 70% rating. Very important. And then the next thing that we're going to talk to you about is your personal care needs. We're going to talk about, again, what a typical day looks like for you, what assistance the veteran needs with what we call activities of daily living. That's going to be bathing, dressing, grooming, toileting, assistance with mobility, feeding. So we're going to talk about that. So there's pieces of criteria that have to be met within those activities of daily living and personal care. The other thing that we're going to talk about is, we do have veterans that apply for the program that may be able to complete their activities of daily living, but due to a neurological condition, there may be a need for a level of supervision for safety. So we're going to talk about that as well, because you can have dementia, you can have a diagnosis of dementia, and still be able to bathe yourself, dress yourself, groom yourself. You may put winter clothes on when it's 100 degrees outside. So you need that level of supervision for safety. So we're going to talk about that too. And then we're going to talk about what the application process is going to look like moving forward. So for the comprehensive part of the program, that does have a financial component. Caregivers receive a monthly monetary stipend, and that stipend is based on the level that they're approved at, whether it's a level 1 or a level 2. A level 1 is still going to have personal care needs, but not an extensive amount of personal care needs. A level 2 is likely going to need assistance with all personal care or 24-hour supervision. So the amount of the stipend is dependent upon being approved at a level 1 or approved at a level 2. So these are some of the additional services that are included as a PCAFC caregiver. Obviously, our PCAFC caregivers are eligible for all the resources I just talked about, as far as skills training, support groups, workshops. They also receive what we call enhanced respite care. So they're eligible for additional respite hours than the general veteran population because they are an approved PCAFC caregiver. They're also open or offered counseling through our virtual psychotherapy. Typically has to be related to caregiving, but it's an additional resource that they are eligible for. Benny travel, if they're traveling for trainings for veterans care, and the veteran's not already receiving Benny travel, it will be specific for just that caregiver. And then, of course, the monthly stipend. And then for any caregivers that are approved in the program that don't have access to health insurance, don't have any other option for health insurance, then they are eligible for CHAMP VA. And then they're also eligible for legal and financial planning. This wouldn't be like I'm having a dispute with my neighbor about a property line. This would be something more related to healthcare. So assistance with healthcare, power of attorney, living will, advanced directives, some estate planning, and then they can connect them with financial services. There's a 90-day financial planning program that they can enroll in. So the process for PCAFC approval is very different than the general approval, mainly because it does have that financial component. There is an application. It's a VA Form 1010CG. It's to apply for the program. It's a very simple application if you look at it. It's basically demographic information. It's probably the simplest application you'll see. Just demographic information, who you want your caregiver to be, and that's pretty much it. And then when we receive that application, then we start to process it. We try to process applications. Our benchmark is 90 days. We're typically around 97, 98% of meeting that benchmark. So we do move very quickly and efficiently to complete our applications within 90 days. If the application is for a hospice patient, then we do try to triage those and move those through the process much faster. So we contact you. We do what's called an application intake. We look to see if you meet that 70% service connection. We talk to you about what you're applying for, make sure this is something you want to continue to move forward with. And then we do assessments. So, and part of those assessments are over the phone. Some of those assessments can be through VVC or through video. And then some of the assessments are a home assessment. So that's all part of the application process, mainly to just paint as accurate of a picture of the veteran caregiver situation as possible, so that the regional office or our VISN has all the information that's available for them to make an accurate decision on approval or denial of this application. So in that process, we are doing a thorough chart review. We're trying to get as much information from you as far as what your typical day looks like. So the more information that you can share, the stronger the application is. And our job, as part of the application process, is to walk you through that process, to be your advocate, to make sure we're getting as much information as we can, so the people who do make the decisions about the applications have all the information that they can get, and also making sure that we have non-VA medical records. We want to make sure that, again, we have everything that we need to make the best decision possible on the application. And then for approved caregivers in the program, we do annual home visits, we do check-ins, and then again, our caregivers are all eligible for that additional support through the general caregiver program. So these are just some testimonials that we've received from the program. Excuse me. All the kind folks I have met through CSP have me realize that I'm not alone in my struggles. It's huge. That's what I hear so often is, again, it goes back to caregivers connecting with other caregivers, learning from each other, learning that they're not alone, learning that there's people out there that feel similar to how they feel. Knowing that I have someone that I can call is very important to me. Just to hear that CSP's voice, they all have a caring way of making me feel like they take care of me. Through CSP, you have professionals and other caregivers willing to help you through your journey. Nobody in my life understood. They just brushed it off. It was hard for me to cope. It was nice to know that I wasn't alone. So I'm going to leave the hotline number up if you want to write it down. Again, the flyer's out on our table. I do have some time. I'll be happy to take some general questions. If you had an application or have one, we'll be happy to talk to you about it just for privacy issues during the break. Happy to do that, but I'll be happy to take some general questions as well.
About the veterans that are in denial about the need of a caregiver, you can support the potential caregiver regarding that, right?
Yeah, absolutely. So tell me a little bit more. Can you give me an example?
Well, let's say we have veteran X, right, who presents themselves healthier than they really are.
Yeah.
Right?
Happens a lot.
And that, right. So how can you help the caregiver, the partner, or somebody that's involved with the veteran, get that veteran to be evaluated, get it on their record that they indeed have these issues?
Yeah.
Where the veteran's in denial, I'm okay.
Yeah, I think a lot of that, to answer your question, there's a couple pieces to that. One of the things that we try to do, and was a mission of our program for a couple of years, was inclusive care. To have caregivers a part of those appointments, a part of those meetings, to feel wanted in those meetings, and to advocate for themselves to be a part of those conversations like in primary care. It's okay for that caregiver as long as the veteran's open to it. That's a part of that layer too, that we want caregivers to be a part of those visits. We want them to be involved, and we do trainings actually with staff in the hospital on inclusive care, on how to incorporate caregivers in their visits. So that's a part of one way to handle that. The other thing is too, a lot of our conversations are separate with the caregiver alone, and the veteran's not present. So a lot of times, I'll try to give you an example. I was doing an assessment, and one of the questions I asked the veteran was, well, how often do you drive? Oh, I drive all the time. And so then I did the assessment with the caregiver, and she said, he hasn't driven in 2 years. Or he just drives to Hardee's and back, which is like a half a mile. So it paints a better accurate picture when we have those moments with the caregiver, just the caregiver, to paint more of an accurate picture. Because, yeah, a lot of times veterans are in denial about how much care that they need. And we can often pick up on that. But I think it's important to have those conversations with caregivers so they feel like their voices are heard, and that the doctor or social worker has an accurate picture of really what a typical day looks like and what's going on in this situation.
And so the other question was that you folks are providing support, let's say veteran X, a Vietnam veteran who has PTSD, right, who's in the caregiving, process. His PTSD is getting worse, right, and they need support. So that's something that you would provide for the veteran, dealing with the caregiving and dealing with their PTSD getting worse.
We would deal with the caregiver, specifically the caregiver.
But again, there are veterans out there that are providing the care that are having difficulty and burning out, and needing the support. But that's kind of what the program does.
It is, absolutely, and that goes back to REACH, and that goes back to some of our services specific for PTSD. Our program, to be enrolled in either program, the care recipient has to be a veteran. Okay, so a lot of times we get situations. This morning we had a veteran who's caring for their spouse and wanted to know what services are available. Unfortunately for our program and a lot of programs at the VA, including some of the non-institutional care services that Dr. McGoy mentioned, the care recipient does have to be a veteran. But that is why we rely heavily on our community partners and our community resources, because we still want to support that veteran who's a caregiver to a non-veteran, But the way that we do that is connecting them with community resources and community partners. The Dementia Caregiver Support Program, I want to mention them. I don't think they were able to be here today. Wonderful program. They will support veterans caring for a spouse that may be a non-veteran or their loved one, as long as it's dementia related. So a lot of times we refer situations where the veteran is caring for a non-veteran with dementia to the Dementia Caregiver Support Program. And that is a way for support in those situations. Yeah. Mm-hmm.
In the Comprehensive Caregivers Program, you have a primary and in the Comprehensive Caregivers Program, you have a primary and secondary caregiver. So the primary, we understand, has this, but the secondary, what exactly will the secondary get?
That's a really good question. So yes, you don't have to have a secondary caregiver. There is an option on the application that you can list a secondary caregiver. It's not necessary. You can have just a primary caregiver. But we do have veterans in the program that have a primary caregiver and a secondary caregiver, and in some cases a secondary caregiver. Primary caregivers are the ones that receive that financial stipend. So that stipend goes directly deposited to the primary caregiver. The secondary caregiver does not receive that stipend. Now that's a situation where that would be between the primary caregiver and the secondary to figure out that financial component. They are eligible for all the trainings and all the workshops that I reviewed, but they don't receive the financial stipend. The purpose in having a secondary caregiver sometimes is an easier transition. So, for example, if a veteran has a primary caregiver and that primary caregiver unfortunately receives a diagnosis of dementia, has a stroke, their care needs change, and perhaps their care needs are higher than the veterans, then that secondary caregiver could jump into the role as the primary caregiver. Does that answer your question?
So my question is, do I understand that if there's a caregiver, that a caregiver or a spouse can sign up to be a caregiver even though the veteran currently doesn't have
The care needs?
the care needs, yeah.
Yes, they would be enrolled in the general caregiver support program. So a lot of times veterans and caregivers will apply or be interested in the comprehensive part of the program, but they don't meet criteria, at least not yet. They may not meet the service-connected criteria, or they may not meet the care needs. So we still want to support that caregiver. So we would enroll them in the general caregiver program indefinitely, or until the veteran meets the care needs to apply for the comprehensive part of the program. A lot of times I'll enroll caregivers in the general program in that situation, and I'll tell them it's a right bridge into the comprehensive program and already be involved in the caregiver community, receive our newsletter, know what's happening at the VA in caregiver support. But in that situation, they would be enrolled in the general program and then transition to the comprehensive program when their care needs increased.
Okay. Hey, so with the general care and
I'm listening. I'm grabbing my water.
Okay, in the general care part of the program for respite care, so the first question is, does that include like help with household tasks or bathing and things like that? For the general program where the caregiver is not applying for the stipend, they're just, trying to get extra help in the household.
Yeah. So that is a service, but it doesn't fall under the caregiver support program. It falls under non-institutional care services. So GNEC provides homemaker home health aid services and determines agencies that the VA can send out to provide assistance in the home. So yes, it's an option. It doesn't come through caregiver support though. So we get that question a lot. It makes sense because we're the caregiver support program. But in-home support, sending someone out to the home to assist that veteran with care, really needs to go through the primary care social worker first. They'll do an assessment. And I'm glad you mentioned that, because one thing I always like to say is every veteran has a primary care social worker. You have a social worker assigned to you whether you know it or not. Excuse me, my throat. Because you're enrolled at the VA. So if you have a primary care doctor, you have a social worker. That's who the first person that I would be telling that caregiver and veteran to contact, because that social worker is going to ask questions as far as what the needs are in the home. if they need assistance with personal care, bathing, dressing, grooming, toileting, that determines how many hours that the VA will pay for in-home supports. But that's not us, but we would refer them to their primary care social worker, who then works with GNEC and non-institutional care to coordinate those services and sending an agency out to the home.
I'm kind of confused about one thing. Alan was talking about if the person needing the care is in denial. I thought I saw a slide earlier that talked about how to qualify for this program. The veteran needs to be, the recipient of care needs to give their approval. So if someone is in denial, they may not give approval, so therefore they would not be, the caretaker would not be eligible for this program.
That is correct. So in order to be eligible for the program, there does have to be an approval from the veteran. They have to be enrolled at the VA. It's typically a conversation that we'll have with the veteran to confirm that the caregiver is the caregiver. It's criteria, unfortunately, and I totally get what you're saying. But for the formality of enrollment, the veteran does have to be an agreement that the caregiver is enrolled in the program. Good question. Good eye. Yes.
Regarding getting that's something that you could work with the family to get the veteran to go along with the process.
Yeah,
To
absolutely.
get them out of the denial into the acceptance phase.
Yes, part of our process, we do what's called a veteran intake. And so we talk to the veteran about our program to try to get their involvement because of the agreement piece that you mentioned. So that is part of it, is having that conversation. Yeah. I think I've got five more minutes.
Yes. Okay, on the Comprehensive Caregivers Program, eligibility.
Mm-hmm.
Okay, I have the 70%. I have ADLs that need, but yet I can put on my shirt, but I need help putting on my pants.
Okay. That would still meet an activity of daily living.
Will it qualify?
It would qualify as a need for assistance with dressing, yes. It doesn't matter if it's pants or shirt.
Okay.
So, am I on? So acknowledging that in the case of dementia, denial is probably built into the diagnosis, how would that, is there any workaround, like would the caregiver also have to be a guardian? Would that, is there any way to get through that?
Yeah, there is. Yeah, we would hope that there's a healthcare power of attorney on file, especially if there's a diagnosis of dementia. Of course, we wouldn't be able to have a conversation with the veteran depending on the level of dementia, as far as are you in agreement that your caregiver, your spouse, your whoever you designate as your caregiver can be in this program. So that's why there's a huge push, and I'm going to say this too, to complete an advance directive at the VA. Please ask your primary care doctor, your social worker at your next visit, do I have an advance directive? And then also they can pull it up and look and see if it needs to be updated. It could be from 2012. It could need changes in names, addresses, phone numbers. But we would look to and hope that there would be a healthcare power of attorney in that case that would be able to make that decision. Not necessarily a guardian, but a healthcare agent. Good question. Thank you, guys. We'll be out at the table at the break. Please feel free to stop by, ask us any questions. Thank you for coming today, and thank you to everybody that's already been thanked. Thanks for coming, and happy to be here and happy to answer any of your questions. Thank you.
Thank you, Dr. McGoy and Emily Pitts. A lot of good information. We'll take a break, refreshment break, and we'll come back in about 15 minutes. Thank you. Okay, what we'll do, there was a few questions regarding the appeal process for the assistance program. So Emily will go over a few aspects of that. This is Emily Pitts.
Thank you, Alan. Yes, I meant to mention it wasn't on the slides, but it's a question that does come up quite frequently. Is there is an appeals process for the comprehensive part of the program for an application that, for whatever reason, is denied. Typically, it's because the personal care needs are not met. The care needs are not significant enough to meet the definition of a caregiver for that specific program. If a veteran and caregiver are denied for that program, the veteran and caregiver have a right to appeal that decision. Just like VBA benefits, there's an appeal process for pretty much everything at the VA. It's no different for the caregiver support program. So there's different levels of appeals. We tell veterans and encourage veterans and caregivers to start at the local level of appeals. So what that means is contacting your patient advocate. And we have trained them. They're trained in our appeals process. They will actually start the appeal process for you. Doing it at a local level, there's a lot of reasons that's a better option than starting at the Veteran Board of Appeals, which is the top option for appeals. That process can take a year to years, unfortunately. So you really want to consider appealing at the local level with your patient advocate. Once you choose to appeal the decision, your application goes to a different VISN. Think of VISN as a region. It will go to a different VISN, a different regional office, which means a different set of eyes. A different set of eyes reviewing that application, and then they will review it and they will determine if the application is approved or denied. So there is an appeals process. I encourage you to start with your patient advocate. The other thing I tell caregivers and veterans to think about and consider is, has anything changed since the last time you applied? That's something you really want to ask yourself. If something has changed, for example, a new diagnosis, change in your medical condition, a stroke, something that has increased your care needs, you may want to consider not necessarily appealing, but reapplying for the program. There is no rule that you have to wait 30, 60, 90 days to reapply for our program. You can apply today, be denied, and then reapply the next day. So there's no rule about that. The reason that's important is because if you appeal, the only evidence and documentation that they're going to look at is everything that happened since the time that you applied. So nothing new will be reviewed unless you reapply for the program. So there is an appeals process. Start with your patient advocate first and foremost.
Thanks, Emily.